with us.
For 30 years, Portland Police and Fire could call the Cheers van to take people to Central City Concern's sobering station. It's a place where people could be taken involuntarily to come down off drugs or alcohol. Central City Concern says the sobering station would get about 10 people per day.
They would come and provide that community member a safe transport to a safe location where they can sober up and hopefully get additional services.
That provided one of those just temporary holding tanks that we needed so desperately in that time when they just can't take care of themselves.
But last week, both of those services stopped for good. Central City Concern said the type of people who need involuntary holds has changed since they started the program. Staff were increasingly seeing people who presented a risk of violence to themselves and others, so they had safety concerns. CCC also said it could no longer provide the level of medical care people needed. Police and fire say they've also seen the landscape of addiction change on calls.
It hasn't decreased. I can't quantify it, but just the anecdotal side of me is that it's gotten worse. You see a lot more harsh drugs. You see folks that are increasingly living on the street, the chronic homeless that you see.
We know that just in 4 or 5 years, we've seen an over 100% increase in the amount of overdose calls that we're getting. So that tells us that there is an addiction problem here. We already knew there was, but we're seeing it in the statistics also.
With the closure, police are now taking people to the hospital instead. Unity Behavioral Health is about a 5 to 10 minute drive from where the sobering station used to be, depending on traffic. They told me they haven't seen an increase in people showing up there just yet. As for Portland Fire, they're expecting 911 calls to increase.
Basically how that affects us is they're not out there proactively pulling them off, so we're probably going to get more calls to actually go out there, make the evaluations, decide what's best for them, and then either be asking our police officers to make that transport or ambulances.
Portland Mayor Ted Wheeler sent me a statement saying, in part, resuming services provided by a sobering center is an extremely high priority. We absolutely need that service restored in this community as quickly, thoughtfully, and safely as possible. For now, though, there's still no long-term solution. Portland Fire says this closure also impacts the new street response team because one of the difficulties is figuring out where to take people who need help. CCC is still running its Hooper Detoxification Center, but that one is for people who voluntarily seek treatment, so it's not an option for police to take people there while they figure out another solution.